Queenslanders are being asked to mask up once again at public gatherings, hospitals and flights by doctors as the eighth COVID wave hits the state. Lauren Forbes joins us from the Gold Coast. Lauren, we know that the health system there is under pressure. We're standing by to hear some more about this shortly. I flagged that it might be this hour, but we're looking for it at the top of the hour. We'll be getting an update in terms of the COVID situation in your state.
We are indeed standing by, Ash, and that's as reports this morning were released that Queensland's hospital system is under pressure as COVID hospitalisations have more than tripled since the start of the state's 8th COVID-19 outbreak. Now, there are more than 245 people in hospital with the virus. That's up from 75 from the beginning of last month, and doctors are encouraging members of the public to mask up in hospital settings, on public transport and in large crowds in the lead up to Christmas.
We just don't want a repeat of previous Christmases. We don't want to overwhelm our hospital system, and we don't want to lose any lives, which is why it's really important for people to go back to doing what we know they do really well, which is getting their boosters if they need one, putting a mask on if they need to wear one, washing their hands, also avoiding going out if they're sick.
Now, the Queensland AMA president has hit out at Queensland Health for not being transparent enough to the public about this current wave.
It is a right to know what's going on in the community, because then you can assess your personal risk and you can take steps to make sure that you do everything possible to protect yourself.
Despite all this, one of Australia's top doctors, Nick Codsworth, has rejected that Queensland is even facing an 8th COVID-19 wave, and he has also rejected calls for a mask mandate.
Wave in Queensland, but I want to remind our viewers that there are over 1 million admissions to Queensland hospitals every year. So the suggestion that this is a wave is probably incorrect. We don't need to go back to masks, and we need to remind ourselves that the Australian Medical Association is a political lobby group.
Now, as you mentioned there earlier, the Queensland Chief Health Officer is expected to provide an update on this current COVID wave and the hospital admissions. That will be happening in roughly half an hour at 1 p.m. Australian Eastern Standard Time and 2 o'clock Australian Daylight Savings Time. Ash?